Good morning. Thanks for your question about a prominent ear correction. You've asked, does your fabulous, asking your fabulous surgeons, do we think your daughter, I think your daughter's probably fabulous too, does she have to be 18 to have her ears pinned privately? She hates them and always tries to hide them. I don't think there's anything wrong with them myself, but she's really not happy. She's 16. Okay. First of all, great on you for being supportive because it's totally not about what you think on this one. When parents, we normally have this the other way around as surgeons, parents bring in their children to have a prominent ear correction, and the child is sort of sitting there oblivious, quite happy with their ears as they are, and under those circumstances, we wouldn't do it. But in the converse situation where she's 16, she hates them, what we would try to do is make an assessment as to whether this is a bit of a phase or whether this is something that's likely to be persistent, whether there has been a behavior of really disliking her ears for a while, there might have been teasing or bullying or these kind of things going on. And if the patient, and in this case that's the child, or 16-year-old, so she's not really a child, but your daughter, if the patient wishes to have the surgery, then we will agree to it. And I have done on that basis prominent ear correction. I can remember one in a 9-year-old quite recently, and younger, I'm sure. What's important is that that child is able to express that they personally want the prominent ear correction and that that has been a pattern of behavior for a period of time. Then we need to assess the best way to do it. And that can either be done surgically or through it's still surgery, but it's minor surgery in the clinic with earfold. Surgery involves at this kind of age, sort of pre-10, 11, 12-year-old, it normally involves a general anaesthetic. Older than that, depending on the maturity of the child, it can be done under local anaesthetic at 16. Your daughter would probably be suitable for local, but she may prefer to have a general anaesthetic. You don't need to stay in hospital overnight, and there's a head bandage to wear. Now, earfold, alternatively, involves the insertion of some clips, permanent clips, into the ear, which are curved once they're inserted, and that recreates this fold. It's not suitable for all kinds of prominent ear, but actually is suitable for the majority of kinds of prominent ear. And at the consultation for earfold, in advance of it, if you're deciding you want to have it, you can try it with something called a pre-fold, which is sellotaped to your ear, and it will show you, it will simulate really nicely the result that you would get. And people find that quite comforting because they can see, okay, I won't look weird, I will look better, I can see how this will be. It's a really nice way of planning it. And that is done in the clinic. It takes around, 20 minutes. It's very quick and straightforward. The longest part of the process is the planning in advance. It's a very small incision, and recovery is really fast. No head bandage except at night. I had someone fly in from Australia to have an earfold done with me, and then went from the earfold surgery on Friday to a wedding on the Saturday, which is actually what he'd flown in for. And he says people didn't particularly notice that he'd had surgery. There was a bit of swelling, and one or two people said, hey, what's gone on? But basically, he was okay for social company. So right, long answer. There are your options. Yes, it can be done in a 16-year-old. All right, good luck with your research. Take care. Bye-bye now.